This presentation is about the Emory University Athletic Training Residency Program. We will use this video to demonstrate what exactly it means to be an athletic trainer in the clinical setting, as well as what our specific program has to offer. An accredited athletic training residency is a crucial step of professional development between graduate education and autonomous clinical practice. The Commission of Accreditation of Athletic Training Education, otherwise known as CATE, is an entity that establishes and ensures accreditation standards for programs that qualify. Residents in accredited programs benefit from structured mentorship, comprehensive specialty training with vigorous quality and educational standards, and structured didactic curricula, all of which are set forth by CATE. Formal clinical development, structured didactic curricula, and scholarship within the specialty area are pillars of residency programs. Completing an accredited athletic training residency is a transformative experience that provides professional development, furthered education, expanded career opportunities, and increased compensation for athletic trainers. There are 8 specialty areas of current CATE accredited residencies. Ours specializes in orthopedics. The Emory Athletic Training Residency is a 1-year educational program that begins in June of each year. It is one of only 12 athletic training residencies currently accredited by CATE. Our comprehensive program produces graduates that are successful in the clinic, operating room, and on the field. Here we have 2 testimonials featured on the CATE website that include our alum. Here we have Dana and her input, as well as Johnny. So why our program, why Emory? It is our mission to serve as an educational program that provides certified athletic trainers with the opportunity to give quality patient care within the orthopedic realm. The residency emphasizes a professional and team-oriented approach that allows for efficient clinical management and understanding of musculoskeletal injuries. Throughout the year, athletic training residents will rotate amongst multiple orthopedic surgeons, non-operative providers, biologic specialists, and we have an administrative post as well. There is a $47,000 stipend for the year, along with medical, vision, and dental benefits. We do provide retirement matching. Once state licensed as a certified athletic trainer and orthopedic technologist, residents will complete a course in aseptic technique to learn how to navigate in the operating room. So as athletic trainers teaching other athletic trainers, we already know that you're an orthopedic specialist. It's our job to take that foundation and existing knowledge that you already have and simply build upon it. In the clinic, residents will work closely with clinical staff and see patients in the outpatient setting. It's here where residents will evaluate orthopedic injuries, interpret radiographic findings, develop clinical diagnosis and plan, be a part of the surgical planning process, and provide patient education. In the operating room, residents will be trained to serve as first assist to an orthopedic surgeon. It is here where they will learn operating room skills such as patient positioning, prepping and draping, positioning of arthroscopic and open surgical instruments, tissue retraction, suturing, and sizing and preparation of tissue grafts. Some other responsibilities will include conducting and presenting research, attendance of didactic lectures, journal clubs, and grand rounds. And residents also have the option to work a variety of PRN opportunities at local high schools or colleges if they wish for additional compensation. So since our program is CATE accredited, there are firm guidelines we must comply with to track educational progress with our residents each year. One tool that we utilize is a comprehensive test that residents complete during the first week of residency to gauge their clinical knowledge at baseline. They then repeat the same exam at the end of the year for comparison. And this serves as an objective device to track how much they've learned and to ensure we're supplying adequate didactic education for our graduates as well. So how will I learn? Throughout this 1 year, participants will learn through a combination of structured didactic lectures, orthopedic grand rounds, aseptic training, journal clubs, case study presentations. We will send them to professional conferences and independent scholarship. One benefit our program offers is extensive exposure and experience within the operating room. On average, residents last year scrubbed 127 cases. During the year spent at Emory, they'll spend a majority of their time being taught by sports surgeons, so plenty of ACL reconstruction, rotator cuff repair, Bankart reconstruction, etc. But we also do make a point of introducing them to other subspecialties within the spectrum of orthopedic surgery, and that can include trauma, joint arthroplasty, hand, upper extremity, foot and ankle, and pediatric medicine. Dr. John Zoroinas, Spiro Karas, and Sam Labib are three giants in the orthopedic surgery world, and we're lucky enough to have them as physician preceptors to our residents. Here we have the rest of our faculty, all athletic trainers and physician extenders. We have Brian Baer, Program Director Janae Coles, Regina Hash, Megan East, and Brooke Torres. Here are our 5 current residents of the 2023 to 2024 cohort. We have Sarah, Jordan, Matt, Kelsey, and Alyssa. Currently at Emory, we employ about 80 athletic trainers, 19 of which are Emory residency trained, and both of these numbers keep growing by the year. Here are some metrics regarding our completion rate and subsequent employment rate over the past 6 years, both of which are 100%. Here we have the application requirements needed for consideration. They are also listed in great detail on our residency website, as well as everything you'll need to include in your application. We have that listed here. So some important dates we have coming up include a virtual open house on November 6th, during which we'll show our facility, introduce current residents and preceptors, and answer any questions that you have about our program. Our applications are accepted from December 1st of 2023 through February 16th, 2024. We strongly encourage you to learn more about us on our website, which can be found by searching Emory Athletic Training Residency. You can also follow us on Instagram at Emory AT Residency to see our day-to-day activities of current residents. Thank you so much for your time. We hope you've learned a little bit more about what it means to strengthen your education and career by participating in a residency program. And we hope you consider Emory as a future career choice.